So today we are doing the Educator and Parent Town Hall. It is brought to you by highcovid.org, and we are having a special presentation and guest, which is PAAC, and you'll learn a lot more about them today. I will be your moderator. I'm very honored to be moderating this town hall. My name is Kara Flores, and I am the founder of Hale Hawaii. All right. So now we'll get started. Let me go ahead and share. Our first guest is going to be Leilani. I'm going to bring her up to do a pule for us. Leilani is an RN. Leilani Kaho'ano, if you want to go ahead and get started, you can share with us. She's also the founder of Caring for Hawaii Neonates. Let's welcome Leilani.
Aloha, can you hear me?
Yes.
Oh, aloha everyone, aloha kako. And it's an honor to be here with all of you, especially being one of the co-founders coming in on the second circle of high COVID last year in April of 2020. And to be welcoming all of you in this oli that I'll do a very brief one that was passed on to us by our kumu. It says we've waited for this time to gather, and may we join together, and as we move forward in whatever the purposes of this meeting, that it will be fruitful for all. Thank you again for being here tonight. O ke koa hewa ko hualo kelei ka velauiluna. E wailo nua ka ima ka make ka mai hoi. Aloha e. Aloha.
Beautiful. Thank you so much. Wonderful start to our meeting. All right, so our first guest who we are really excited to bring up today is Dr. Scott Miscovich. He is the president and founder of Premier Medical Group. He has also provided over 60% of all the testing in Hawaii and was especially helpful at the onset of our pandemic. In 2019, he was selected as the Medical Association Physician of the Year in the state of Hawaii. He's also frequently on CNN as a COVID-19 analyst, and right now he's joining us actually from Japan, I believe. He's helping with the Olympics with their COVID-19 protections as a consultant there. So let's welcome Dr. Scott Miscovich to tell us a little bit about what is different about the Delta variant that we're seeing right now.
Thank you. Thank you very much, and thanks to everyone. And that was such a beautiful introduction for our Hawaiian blessing. So I'm here to talk to you, first of all, as just basically a physician who has been caring for the people of Hawaii since 1988. And I've been very fortunate to be able to be across the country and now speaking to the world on CNN and in 21 different states caring for our country, both with things like I wrote and designed the Return to Sports for the SEC conference, and numerous states. We're doing colleges, we're doing university testing. We're all over the state of Arizona and other states where we're doing the underserved and the underprivileged. And needless to say, I have a very broad perspective now of COVID. And I am also fortunate to be able to be dealing with the experts of the world. And one of the things that is concerning to me now as a physician is the dangerous Delta variant. And I just don't think that we're getting enough of the truth overall to talk about really what this means. Now, just to give everyone a little perspective, the Delta variant, we heard a lot about it in India and what it's done in India. And now it's spreading through the world. As of yesterday, 83% of all the cases in the United States now, per the CDC, are the Delta variant. Now, back when we had the original Wuhan COVID, that the Delta variant now is about 225% to 250% more contagious. Now, I said this on my last CNN event, but I want to highlight the biggest scourge to the world in the last period of time. Everybody's heard of smallpox. Well, the spread or the contagious number for smallpox was one person could spread it to about 4 to 6 people, which was quite contagious. The Delta variant has gone from the original Wuhan virus of 2 to 2.5 up to 5 to 8. It is more contagious now than smallpox. Fortunately, not as fatal, but it is more contagious. That's why right now, I did my data check, which I do multiple times through the day. We have a percent positivity in the United States now of 12 different states that is closing in approximately 15%. And what that means is 15% of every test being taken is a positive. That usually projects to double the number of people in the country in those states actually have the COVID and they're not doing enough testing. That means the angle is this way. In the state of Hawaii, our percent positivity is kicked up to closing in on 4%, and it varies in different areas and different regions. Now, one of the things that's very serious about this is that the incubation period is approximately now 3.5 days, and that's compared to the 5 to 6 days. Once someone contracts COVID, we're finding 1,260 times, not percent, times the amount of virus that develops and replicates in their system. Hence, we're seeing the big proportion of the non-vaccinated 20 to 50-year-olds, which is the biggest group that are getting ill, are getting very ill very quickly, and our hospital rates in these high presentation states, especially in the South and other areas, is just going through the ceiling. So I'm here to just talk about the reality. The Delta variant is serious. It can affect the 20 to 50-year-olds. Our children can be affected by the Delta variant. The admissions by children are increasing significantly. ICU admissions and regular hospital admissions. So from that perspective, the Delta variant is something we have to be serious about. It's serious, and we have to consider that right now in Hawaii, we are about 60% of our population vaccinated, but we have 0% of our children that are 11 years old and younger. We will not have a vaccine presented by Pfizer after it goes through its approval, probably available till November at the earliest. The approvals will hopefully come through. And so the final thing I want to say is, if you're unvaccinated and or if your family members or friends or anyone who may have a risk factor, obesity, heart disease, high blood pressure, diabetes, maybe pulmonary disease, take it serious. Wear your mask. Indoors especially is where this occurs. And we are now at the same peak of hospitalizations in the state of Hawaii for COVID as we were when we had the peak pre-vaccine. So I'm just here to speak to everyone as a physician caring for Hawaii to tell you that this is a serious disease, nothing like we've seen yet in COVID. And now we're going to talk more, and I'll be happy to speak more about our concerns as a group about returning to school. But otherwise, thank you very much. I'll be here. I'll take questions, and stay safe, wear your mask, social distance even further, because now the contagious nature of this disease isn't 6 feet and 15 minutes. It can be 30 seconds. It can be 1 minute. And you can be spreading it because of how contagious and how much virus is being spread in our respiratory droplets. Thank you.
Thank you so much for sharing that information with us. We will have Dr. Miscovich on as a panelist if you guys have questions later. At this time, I would like to bring up one of our favorite people for Holly, Hawaii. One of our favorite consulting people is Professor Lee Altenberg. He is a PhD and associate professor at UH Manoa. He's also a member of the Hawaii Pandemic Applied Modeling Work Group. He's internationally recognized as an expert in theoretical population genetics, or as we might understand it, population modeling. So Dr. Lee Altenberg, do you want to share a little bit about what you do and kind of what you're seeing with Delta variant, something we can look out for?
Okay, thank you for that introduction, Kara. So I'm a modeler, and when I try to figure out what's going to happen on a large scale, because even though every infection is like a random event, a chance event, bad luck event, when you add them all together on the scale of a whole population, you see definite patterns. And so I want to cover what the impact of the Delta variant with that very high reproduction number is on this pattern of growth in Hawaii. So I will share some slides now. And can you see it? Okay, so first I want to introduce this key term, which is the reproduction number. And that's how many persons one infected person infects. Okay, so R0, that's the reproduction number at the start of the pandemic when there's no mitigation and no immunity. So RT is the reproduction number at time T, and that's given everything. So masks, vaccines, social distancing, immunity, everything. And if RT is greater than 1, then the infections grow in number. So that's the crucial value that we have to keep in mind. So let's review what the reproduction number has been in the pandemic in Hawaii since the beginning. Okay, so let's go back to March 2020 when it first hit here. Then we look at the growth rate, and if we fit an exponential growth to it, we get an R0 of 2.2, and that's on the low side of the estimates, but I'm going to use that throughout. Then just before, just at the end of March, we had the first stay-at-home order. And then we got an exponential decline in the case numbers, and the RT is about 0.66. So that is a 70% reduction in R. So we know if we're in a really terrible state that we do have as a last resort, a stay-at-home order will substantially reduce that reproduction number. But now let's look a little later what happened. So in June, after the stay-at-home order ended, the numbers started drifting up with an RT of 1.2. Then in mid and late July, it accelerated to 1.7. Now, probably the virus wasn't changing in that time, but it was people's behavior that was changing. And that's when we started to see the 3-digit cases above 100. And as they got higher and higher to 200, things started to flatten out. So people started to become more careful, but the RT was still above 1. It was 1.1. And that's when we started getting our peak of about 350 cases per day. So here on August 27th, without anything else slowing it down, the governor declared the second stay-at-home order, and that caused the case numbers to plummet, and the RT was about 0.54. And then at the end of that 2-week stay-at-home order, people, I guess, were being pretty careful and kept the RT below 1. And so the numbers drifted down when it was about 0.96. So now in October 15th, the Safe Travels program began. And so lots of travelers started arriving in Hawaii, and you can't calculate RT the same way because you have an influx of infected people, and that's changing the numbers. So it begins to be driven not just internally, but by the influx of infected people. So that was how it was. How is it going now? So since June 21st, we've had a steady increase in our numbers. So this bumpy road is because the different days of the week have different pattern of testing. So Wednesday is a low day and Thursday is a very high day. So today's cases were 100, and you can expect that tomorrow's cases are going to be way above 100. But the RT now for these past 2 weeks has been 1.34. So that means the numbers are going to grow. So what's the cause? Well, it's been proposed that it was the July 4th gatherings that have caused the numbers to go up. But let's compare this July 4th with the July 4th of a year ago, when we had no vaccines, we had no stay-at-home order. All we had was social distancing and masks. And but we also didn't have travelers because of the quarantine. And we saw this little bump after July 4th, but then after a few days, it went down again. But then it started this relentless increase at the end of July. So here, we don't see anything going down. We see a bit of an increase in the slope after July 4th, but it's continued. July 4th parties are long gone. And so we have to ask, what is causing this continued increase? And in my mind, the obvious answer is the dominance of the Delta variant now in our infections. So let's look at these calculations here. So using that value of R0 of 2.2 that we had at the very beginning of the pandemic, the R0 of Delta is that 2.2 times this, the commonly stated factor of 2.25, over twice as infectious, and that gives us an R0 of 5. Okay, but we're 60% vaccinated, and perhaps about 10% are post-COVID with immunity. So what difference does that make? So let's just do some simple calculations. So if we have 60% vaccinated and about 10% immune from having COVID, so that gives about 30% are not immune. So you multiply the R0 times the number that aren't immune times the Delta factor, and you come up with an RT for Delta of 1.5. So the original COVID with no vaccines and no mitigation gave an R0 of 2.2. The Delta variant with a 60% vaccinated and 10% immune from infection gives an RT of 1.5. So that is not much below where we were back in March of 2020 with no mitigation and no immunity. So now I want to go to this demo. I will switch the share and go and show what these exponential growth numbers look like. So here is this first graph is setting RT equal to the value that it has been the past few weeks of 1.34. And if we keep that up going forward till the end of August, it's not a pretty picture. We would be getting to about 200 cases a day by August, by the day that schools are set to reopen. And by the end of August, we would be over 800 cases a day. So that's what happens if you keep up this current reproduction number. Now, who knows whether we're going to do that or not? As we saw before, when the numbers really climbed in July of last year, people changed and became more careful and they brought it down. So, but let's look at another number. So what about if we change the RT to what it is with 60% vaccinated and no mitigation, then if we were to drop all of our social distancing and all of our restrictions now, then with that RT, we would be having 2,000 cases per day by the end of August. So that clearly is not a desirable outcome. Now, suppose that we looked at parts of the island are not 60% vaccinated. So some parts are higher than 60%, some parts are lower than 60%. If you go to those regions of the island, suppose there's some places that are 40% vaccinated. And that gives us an RT of 2.475. So let's plug that in and see what we get. So if suppose that we only started with 10 cases, in that local region, but we have this vaccination rate of 40%, what happens to our numbers? Well, these are horrendous. Okay. We're north of 8,000 cases a day by the end of August. So that's what difference going from 60% to 40% vaccination rate is.
Wow.
So this is all I can say is concur with the other voices is please get vaccinated. And please, if you have friends or loved ones that don't want to get vaccinated, talk to them and let them know that they're really in danger. So suppose that we get up to a vaccination rate of 7. Okay. Then 70%. Then the RT is 0.99. And in fact, we see a decline in time. So starting from, let's put it up to the 100 cases we have today. And then we see a decline to a 92 by the end of August. So that's in my mind still not a reason to, you don't want to get rid of all mitigation efforts at that point. But you won't have an explosion in numbers. So that's a little bit to show how the difference in vaccination rates with the Delta variant in our current situation, what that does to the potential case numbers that we have going forward.
Well,
so I'll leave it there.
Yeah, that lines up with what we're seeing nationwide for sure in the unvaccinated places versus Hawaii, where luckily as a state we're at 60%, but like you said, we are seeing that some areas of our state, some little pockets have very low vaccination rates. And this really demonstrates why it's important to get our vaccination rate higher for all of our state. So I'm going to move on to our next speaker. And I actually am really excited to share with you guys some news. Actually, Murray Ellsworth, who is a teacher, a local teacher for the DOE, is going to share this with us. But Murray, do you want to share what happened at the Board of Education meeting this past week?
Sure, mahalo. Yes, so I'm a teacher at Waikea High School in Hilo, and I was able to attend the Board of Education meeting last Thursday. And a resolution was passed that had this language in it. And I just wanted to alert teachers because I know that some teachers might be a little worried about bringing up vaccinations in the classroom. But this directive to the Department of Education from the Board of Education is literally encouraging us and urging us as educators to encourage staff, students, and their families to get vaccinated. So you might notice in the purple box the language there. This is taken exactly from the resolution that was passed on Thursday. So please be aware it also has a component toward the end of this little clause that says it also is adding us to lead by example through education. And we're going to get some wonderful free resources from PAAC, who have developed some fabulous modules and stuff that are totally free for educators to use. I would like to just add though, that teachers should be a little worried about asking students if they're vaccinated. I would advise against that personally, because that might violate HIPAA laws, which are medical privacy laws. So you can urge people to get vaccinated. I would not ask them if they're vaccinated, but I would not ask them if their families are vaccinated. But by all means, educate our students and make them the ambassadors of COVID safety, because we don't want them to be like mean to their families. We just want them to be loving ambassadors. And so that's what I suggest is let's make our kids those loving ambassadors that go home and say, hey, you know, we should think about this. This is what my teacher taught me. All right. So thank you. I'd like to pass it back.
Thank you so much, Marie. All right, so now to the most exciting part of our meeting, our town hall today. We have special guest, which is the Pacific Alliance Against COVID-19. This is an amazing group that is getting funded from the National Institute of Health. They are out of UH Manoa, and introducing and telling us a little bit about it, she's going to introduce the whole team, is Ka'olino Kaimana Yasuoka. If you would like to start your part of the presentation, she's going to introduce some of her team to us and tell us a little bit more about PAAC and what they've been working on.
Hi, Kara. Sorry, I lost sharing privileges. Oh, there. Thank you. Aloha, everyone. My name is Ka'olino Kaimana Yasuoka. And before I start introducing my team, I wanted to share just a little bit about background about why I joined the Pacific Alliance Against COVID-19. So originally, we started off as a grassroots effort. I'm a student of Dr. Pauline Chin of the University of Hawaii College of Education. And we first started with a curriculum that we rolled out in early 2020 to educators. And then we became the Kupa'a Collective. And so this team, some of our members are still here with me today. And then eventually we just kind of formalized and I joined the Pacific Island Alliance Against COVID-19 because it became funded by the National Institute of Health. And so the reason why I joined is really because of my Keiki and because of my love for my home mana, my students, and for the love of my communities. And I really saw that there was this need for a grassroots effort of people that were like-minded, that were really about protecting our students. And so I think what we've learned is that when we empower our children, like my children, they often listen to what's happening with my meetings and things, but they're the first ones to be out there protecting their elders, their kupuna. They'll come up to people and if someone comes into our home, they'll ask them to wear a mask properly because we live in an intergenerational home. And a lot of our families here live in intergenerational homes, and that's the concern, right? So I'm also concerned because my older son, he goes to our public high schools, and I really want to know, like, are the children going to be in cohorts? Because that's another protective measure that schools can implement. It's really critical to downsize the exposure that they're going to have, to mitigate those exposures. And so this is why I joined the Pacific Alliance Against COVID-19. And just like Dr. Lee Altenberg showed us, we can make a difference. All of that information that he was sharing with us showed us that we can make a difference. And so right now I'm going to pass it on to Dr. Alika Maunakea.
Aloha mai kākou. I think I'm on now. I'm going to be introducing our team as well. Thank you so much, Ka'olino, for passing it along to me. Just a little bit of background. Again, I'm Alika Maunakea. I'm born and raised in Waianae, Hawaii. I'm a biomedical researcher at the University of Hawaii, John A. Burns School of Medicine. I've been working with our communities for several years, even before the pandemic, on health disparities in our populations, especially in the Native Hawaiian Pacific Islander population. And of course, with COVID-19 added on to that disparities. But I'm joined today with Dr. May Okihiro, as well as Dr. Ruben Juarez and Dr. Pauline Chin, who are the founders, co-founders of the Pacific Alliance Against COVID-19 that we formally established at the end of last year. So this group, we are intending, and we have been working in partnership with community-based organizations, federally qualified health centers, and schools to empower schools as community assets to mitigate the adverse impacts of COVID-19. Before I begin and explain some of the details of our program, I'd like to share a video that kind of captures some of that information to share with all of you. See if I can get this playing. All right.
PAAC is part of a national consortium funded by the National Institutes of Health, TRADEX Initiative, to increase COVID-19 testing capacity and uptake in underserved communities.
PAAC has enabled us to put together a really innovative partnership between multiple entities. This includes federally qualified health centers, including the Waianae Coast Comprehensive Health Center, the Hamakua Kohala Health Center, Bay Clinic, Molokai Health Center, and the Waimanalo Health Center. In addition, we partnered with the Department of Education, charter schools, as well as the Department of Health and community members in each of these communities across the islands.
I oversee the testing unit of PAAC, where my role is to help build capacity for community and school-based testing and assist with interventions to increase the uptake of health services to mitigate the spread of COVID-19. In addition to this, we recognized early into the COVID-19 pandemic that communities we have worked closely with for years have already experienced health disparities and would be more vulnerable to severe COVID-19.
Underserved communities in Hawaii, including those composed by Native Hawaiians, Pacific Islanders, and Filipinos, are shown one of the largest disparities for COVID-19 in the nation. Our team created a new model of testing at schools that was piloted at Kamaile Academy.
When initially approached to partner and do COVID testing at Kamaile, my first reaction is, let's do it. We have the flexibility, we have the autonomy as a charter school, but the real decision was about what's right for our school community to keep our kids and staff safe.
The type of test that we're doing here is a rapid antigen test, and the two types of tests that we're doing are the Abbott Binex Now and also the BD Veritor.
I think the PAAC program and the partnership that we have between Kamaile and PAAC is really strong, and I for one personally want to continue to be able to be tested. I want to know that I have that safety, and I want to go into next year with more assurances that things will be normal, and testing is one really good way to make sure that that happens.
It's preventative measure. So we can come, we can gauge how are we doing in our own communities, with our own families, if we're keeping safe. And it's a good way to monitor. That's why I do it every week, and this is my third time.
It's been really important that we have accurate data during a pandemic so we can make the decisions at our school level. This type of data around COVID testing for our staff is just one more example. This data helps us to make decisions so that we can keep our kids safe and focus on learning, and our staff feels comfortable so we can focus on learning.
In parallel, we recognize that eliminating disparities must involve education. As such, we work with schools not only to test, but also to educate teachers and students. Our team developed a new COVID-19 curriculum that we hope teachers can deploy in the fall. We see teachers and schools as assets in preventing the spread of COVID-19 in Hawaii.
It's always been our belief that the more you can empower students and teachers to have the knowledge to take control over some of the various streams of information that are coming in, that you will have a better control over health. You'll have a better understanding of what is a reliable source of information. So you can go to the modules. We have two different forms of how you can learn about the modules and teach from the modules. One is by videos, and each is about 15 minutes, and the other one is through a PowerPoint presentation. So we're really looking at students and educators in general being able to be collaborators and partners with our public health.
The COVID-19 pandemic has had a huge impact on communities across Hawaii, but we are certain that by bringing together partnerships to address the disparities, to get people tested, to keep people healthy and safe, that we're going to be able to get through this together.
Awesome video. Dr. Maunakea, did you have more to share?
Yes, sorry about that. I'm just trying to get back online. Aloha. I hope you were all able to see that. I'm actually really grateful that we are also joined tonight by Principal Paul Kepka, who was featured in that video. He's the principal of Kamaile Academy. And I'd like to invite him now to share his thoughts on adding testing to prevention practices at schools, and to see what his thoughts are on the next steps for this project.
Okay, aloha kako. Can you hear me? Okay, Alika?
Yeah.
Yeah, okay. There I am. Okay, I think I'm wearing the same shirt I was wearing in that video. So here I go, a few months later. But yeah, I'm just really thankful for the partnership, and I think that Kamaile was really fortunate to be a pilot and a model for the rest of our colleagues across the state. You know, I think for Kamaile, the COVID testing, you know, we tested through the summer as well for summer program. And it's sort of become a culture of the school now, I think, and staff are very, they're asking, you know, making sure, like we had a day off on like a Monday and we tested on Tuesday because staff were asking. And our next step is really to ramp it up, I think, and try to really empower and encourage our children to test, because I think the idea of our children, you know, helping us to share the messages about safe COVID practice with our families in our larger school community is really important. So I think the PAAC educational modules, as well as, you know, getting COVID testing and continuing with the staff, but also with the students, provides opportunity for us to share a message around best practice with all of our larger school community.
Mahalo nui, and I'm grateful also he'll be staying on for some questions and answers. So I wanted to share a little bit more of the program itself and our plans to expand PAAC into other communities across the state. So here's just continuing on the presentation. As you might know, at the national level, Hawaii is actually one of the few, the lower school index in terms of in-person attendees in the country. And this was recent data back in June 29th, 2021. But a recent study that combined other pilot programs across the country that took into account testing has put together a report just recently about the effectivity of mitigation practices in schools. And I just wanted to put that out there as a resource for all of you. Our PAAC school community bubble program includes adults, as well as now we're starting to reach out to the adolescents from age 12 to 17 years old. We consider it a bubble program for home, schools, sports teams, friends, and work. That includes that collecting information and also being able to provide free tests to our community participants. This involves consent and assent forms that we put together in partnership with the Department of Education as well as the Department of Health. And we collect information on the process from participants. The test that we use, as you heard in the video, it's a rapid antigen test. It takes about 15 to 20 minutes to perform, and it's followed by a PCR confirmatory test for any positive cases. We also at PAAC promote COVID-19 education and information, which we'll talk about a little later. To give you a just general idea of what that looks like, this is the antigen test kits that we've been using through, that's been vetted actually by the Department of Health, and we've gotten great support by them to disseminate this to our school sites. And then again, working in partnership with the Department of Education to get this out there. We again make, it's a robust strategy where we facilitate the test. That's a self-swab, and that test is confirmed through PCR if the results are positive. The frequency of the test can be modified, but we start off with once a week and as often as we need for individual participants, and we collect information that really helps to understand how we can best optimize the strategies and platforms to better serve our communities. In order to provide this to other sites, we are collecting a toolkit, excuse me, to disseminate information and lessons learned to our different community healthcare centers that are partnering with us, as well as the schools that surround their districts. The content includes training, equipment, supplies, agreements, policies and procedures, practices, and the checklist that's in place. And our next step for PAAC is we're reaching out to our HERO partners, which are federally qualified health centers that include the Waianae Coast Comprehensive Health Center, Waimanalo Health Center, Molokai Community Health Center, Hamakua Kohala Health, as well as Bay Clinic, who will be working with their surrounding school districts and their school complex for providing not only the testing, but the PAAC information for education. And again, the frequency of testing and the specific protocols will be adjusted according to the community needs. And that includes the local vaccination rate, as well as the social vulnerability index, as well as other educational materials that we need to provide. Now, the collaboration is currently underway, and we'd like to have it in place before the beginning of the school year. Now I'm going to turn it over to Dr. Pauline Chin, who is heading our education unit in PAAC, to explain some of the modules and some of the opportunities that we have for teachers. Pauline?
Aloha, and thank you very much, Alika. First, I'd like to give a shout out to the people who have referenced the education. I'd also like to give a shout out to Lee. Very, very early in February, through a mutual friend, he sent an article about Princess Regent Liliuokalani, who had mandated the lockdown in 1881 due to smallpox. And that turned out to be a kind of a pivotal piece in how we began to think about the modules in terms of the role of leadership. And that has been carrying through, and we notice that students respond to it very, very well. So looking at the modules, we start with a history from Cook contact all the way up to COVID. And then in module 2, we really begin to think about how can students become ambassadors of public health and begin to help their families understand comorbidities and their risks for COVID. Then module 3, we look at the Swiss cheese module, and I want to give a shout out to Kaolina, who wrote this, and a shout out to Kaleo Hanohano, who wrote the module 2. So these are modules that have been written by teachers and tested by their students. And then finally in module 4, which is a little bit more on the technical side, testing vaccinations and variants, we kind of bring it up to the present, and we bring in things that I think students that are in lower elementary grades could understand. So how do you do this for a teacher? Start with the videos. That really helps. Think about how you can target for your population, the course you're teaching, and your students, how you can modify the lessons. Then go into the website, again, download the slides. You're able to modify them, again, for your students. So I want to encourage you to do this because NSF doesn't do this. This is an NSF-NIH collaboration, but NIH is very much more understanding that to encourage people to engage in your research, and we do want to know how effective our modules are. We do need feedback. You can be certified on one or more modules, and this is $50 per module for a total of 200. You can also look at, select which video you would like to give feedback on for $25. So we really appreciate the fact that teachers who are going to be the primary links for educating the students who can go then into the families and the communities and become the trusted messengers. We really strongly encourage you to get engaged. Please go to PAAC.info and you can see the videos, and you can always get back to us also through the feedback mechanisms there. So thank you, everyone. And I hope that this will be useful for keeping our schools safe, because we do know that mitigation strategies do work. It may not be 100%, but if we want safer schools, we will have to take a multi-layered Swiss cheese effect where we want to start with a vaccine, but then all of these other mitigation strategies too. Thank you. Mahalo.
Mahalo, Pauline. And we also like to say mahalo to all of you for being here tonight. And thank you so much for the hawaiicovid.org team for putting this together and hosting us tonight. We were happy to take any questions. Mahalo nui.
Awesome. Thank you guys so much. So this is a really exciting program. And now we are on to the question answer part of our town hall. And first I want to show you guys who our panelists are. So these are who we are going to be asking questions of. It includes all of the PAAC team that is here, of course, as well as Dr. Miscovich, Dr. Lee Altenberg, Dr. Jonathan Dworkin is joining our call as well. We have the principal of Kamaile Academy and a DOE teacher, as well as Dana Moore, who is here with the COVID-19 Healthcare Provider Task Force, also known as highcovid.org. We are both part of that. And we have a contact tracer, Dr. Miscovich's wife, Sharon, as well as a community member who's been following the Department of Education and Board of Education news very closely, so we consider her to be somewhat of an expert on that. So now is the question answer part of our Zoom, and I will start with a question. I would think this is going to go with Dr. Miscovich. It says, should schools that have cohorts allow all kids to eat in the cafeteria? So Dr. Miscovich or any of our medical doctors, if you want to chime in. Do we still have them on here? Okay, let's see. All right. Do we have Dr. Dworkin or Dr. Miscovich? Do you want to answer this question?
Yeah, hi, can you hear me? It's Scott Miscovich.
Yes.
Okay, sorry, I was having a hard time getting unmuted. I'll try to get on video. So yes, very important that cohorting in any setting right now when we have this process that's going on should happen. You know, we should be cohorting. You know, I think there was a term used called Ohana bubbles. As much as we can find that we can have small groups of students or even faculty for that matter together, if we get positivity, we will basically go ahead and we will then have a much smaller group that will have to be contact traced, that will then have to be basically put into a quarantine to then see if they turn positive or not. So the best thing that we're going to do is try to have the children move in clusters and move in groups and have periods of time where they don't go, then have a massive mix, because in that case, if you get a couple positive, and as we've heard the speakers say, with how contagious this is, you could have, as we're seeing across the state right now, you could have a cluster of 5, then 5 equals, you know, another exponential growth of 25 or more, and it could spread. So yes, cohorting will be very important as we get back to school for things, you know, including lunch classes, etc. I hope I answered that.
Yeah, so basically the cohort is as big as the most people you interact with, it sounds like. So if you interact with a lot, it's a big cohort. All right, and then someone else was asking about the distancing. Does that still apply? So they're being told that 3-foot distancing is okay. And do you have thoughts on that?
Oh boy, I have a lot of questions with that. Now, I know since I have so many teachers as patients and I'm very familiar, it's really hard with how crowded our classrooms are to have more distance allowed. That decision to go to 3 foot was not when we had the Delta variant. I think that's one of the highlights that everybody needs to understand from a medical perspective right now. CDC is trying to make these big, broad decisions. They take a lot of data, and all the researchers that are on this call know the data they're pulling up is months and months and months old, and then they have to spend months to analyze it, and then they come out with a decision. Well, we can see what's happening in Hawaii and in the world, how quickly the Delta variant has become the predominant variant. And so at this stage, when they said 3 feet, they weren't talking about something that has those numbers I talked about, 1,260 times the spread in the body, or 250% more contagious. And now we have real world evidence that you can have this spread if you're maskless in periods of 30 seconds to 1 minute. One of the things I do want to highlight to all the parents and educators to discuss that is I really would encourage our Department of Education to have a very solid way that we teach parents and then students and then teachers, so we can have a uniformity on how to wear a mask. There's a difference. I would hope that the Department of Education, and with all the funds the feds have given us, they should be handing out a uniform 3-ply mask to every student. That would be my wish in the state. and have a really fun training on how to use it, because the type of mask now with this new Delta variant is something we're very concerned about, and wearing it appropriately can be the difference between getting the COVID virus or not.
Awesome. Okay, kind of piggybacking on that idea, this school year is a lot different from last school year, because last school year a lot of schools were starting off with distance learning as a precaution, and now I believe every school in our DOE is offering face-to-face learning at some level, with only some of them offering distance learning. So we have a lot more students coming on campus this year. And also what's changed is there's some schools who are choosing to have a very strict mask policy, and some we've seen have even posted already they're going to have mask optional. So what are your thoughts on that? I know the American Academy of Pediatrics just came out with a statement, but saying that they recommend mask in school this year. What, have thoughts on mask in school?
Oh boy, this is another one that if I can be 100%, it's 1,000%. Masks, yes. American Academy of Pediatrics came out and said what all of us recommend is, they're saying actually 2 years of age and older should be in masks. I completely concur. And it even goes further. Vaccinated or unvaccinated, we are seeing breakthrough in the Delta in people who are vaccinated. I think that's pretty widely known in the news. The best study is showing about a 10% breakthrough in the London study that was completed on quite almost 100,000 patients. And fortunately, when you're vaccinated, you do have a very, very low risk of dying, but you can spread it to others around you. So masks are essential. And I think that having the children, once they go outside, depending on how we do the cohort, and I know we're talking about free lunches and hopefully grab and go, we have to also be careful when they go out and they're doing lunches, that if they then go back into a group when they're eating and take their mask off and they're within 2 or 3 feet, we've just kind of lost the advantages that we've had. Of course, they're going to take their mask off to eat. Hopefully it's going to be outside, and hopefully we're going to have a nice distance where they can still converse and still get back to that person-to-person discussion.
Awesome. Thank you so much for clarifying that. So going on to our next question, let me see. Do you think schools will be following the CDC updated definition of close contact, or is school an exception? So do you know what the close contact definition is, and if it's going to be updated because of the Delta variant?
I will not, I would get supplemental oxygen and not hold your breath if you're waiting for that. No, things come out very slowly out of the CDC. And so we're not expecting that they're going to magically change quickly, but the data is clear already that, I think we're going to be living with what we're living with, the 3 feet. And that's why it's going to be so imperative to do the right things with masks and to do the things that we talk about with cohorting. And also, PAAC and this group has been so tremendous in putting out its guidelines. Ventilation. Now, we're not talking about the air conditioning ventilation. We're talking about good old-fashioned trade winds and fans. And it doesn't take too much to have the right ventilation make a major difference. So to do it. And I also am a big fan of schools taking advantage of kind of the old Socrates or Plato type of teaching, and let's go out in a tree and sit around where we can spread out as much as we can. But I really wish there was an updated definition of close contact, and then having across the board, across the entire Department of Education, a very clear understanding then what constitutes contact tracing, because for the parents and educators that are listening, it's a hard situation when everybody's saying, well, do they have to stay home? Do they not have to stay home? Are they quarantined? Are they not? Who gets tested, etc.? Should be uniform. We should have one solid, very clear message sent out to the state of Hawaii to talk about what it is, so that doesn't leave any questions, and it's a safe message for what is contact tracing and what is the right thing to do with the length of time of quarantine, et cetera. So, and testing of those people in the follow-up.
Awesome. Thank you so much. I have Jonathan, Dr. Jonathan Dworkin. Are you on now? I want to make sure he's on.
Yes, I'm here.
Okay, awesome. We have some questions for you, and maybe you could share on some of the questions that we have already had asked as well. But are there any kids this year who you would recommend that they do distance learning, or their parents seek out distance learning specifically?
Thinking about that a little bit, given what we know about the transmission of Delta and the likelihood that it's going to impact the younger age group, I would think if I had a child that I knew was especially high risk and had a number of medical conditions, was either immunocompromised or morbidly obese, or had bad lung disease or had bad heart disease, I would seriously consider what the school setting is for that child and whether or not it's more appropriate to do distance learning, at least until we have numbers under better control. I think those graphs that Dr. Altenberg presented at the beginning were pretty chilling. And we don't really know where we're going to be a month from now or 2 months from now. A lot depends on what happens in terms of the vaccination rate and the social distancing and other behavior. So, there's a lot of things we can do at the school to make it a safer environment in terms of masking, in terms of HEPA filters, ventilation, distancing rules. But if we have widespread community transmission, it's not going to be perfectly safe. So I think if there's a particularly high-risk child, that's the kind of thing that has to be decided on a case-by-case basis.
Awesome. Okay. And then someone else asked if the school screening criteria for symptoms needs to be updated with this Delta variant. Are there different symptoms that we're seeing, or anything that, the school should be looking for?
Yeah, I would be curious to see what some of the other doctors say about that. I saw Scott and Jerry are on the call as well. There have been some reports that symptoms are less specific for Delta variant, but in general, kids don't get a lot of symptoms with coronavirus. We know that a lot of kids have had either no symptoms or minimal symptoms. So symptom screening in general has been an issue for this pandemic. And if you look back at how it originally got out of China, there was a significant amount of minimally symptomatic people or asymptomatic people, and symptom-based screening failed. And that's why it went global in the first place. So that seems to be particularly true with kids who are more likely to have minimal or no symptoms. So I think the symptom screening is certainly a layer of protection, but like all the other layer of protections, it's not going to be perfect. And I don't have a specific set of symptoms that I could give you. I'm sorry, maybe somebody else could add to that.
Okay, awesome.
Just to extend on that point, that's all the more reason to be able to provide some degree of testing for asymptomatic cases on a regular basis. So these are what we call surveillance testing. And I think there's a couple questions around where people can get more information on our on this protocol that we're implementing throughout the state. So please, on our PAAC website, www.paac.info, you'll find links to contact information to provide us with, so we know to get in touch with us and also to work with your school's principals as well as superintendent, that if that's a concern and that's definitely something that you'd like to see in your neighborhood schools, we'd like to, we can share the modules that we've been creating as well as the toolkits that we've assembled as part of the pilot project with Kamaile Academy and other schools that we've been rolling this out to.
Awesome. Dr. Maunakea, we actually have a question for the modules and the stipend. Is that limited to teachers of a certain age group, or is it any public school teacher that can do that?
Any public school teacher. And actually, we would love to get your feedback for younger aged population. So from K to 12, the education modules are geared more towards the older population, so around 6th grade and up. But we would, we think that some of the modules, and as well as our working team, Pauline, you want to mention, our team has been really interested in working with other teachers to bring some of the components of the modules down to different age groups, especially the younger.
Right, right. Hi, this is Pauline. We know that it can be taught. This is one of the reasons that the videos are there. The terminology, it was initially written for teachers of grade 6 through 12. But we think it's so important that young children know how to monitor risk factors and understand some of the issues of how COVID spreads. So please go to the PAAC Info website, view the videos, and if you are a teacher in private schools, public schools, charter schools, Hawaiian immersion schools, the key is that the way the grant runs, the incentive can only be provided to Hawaii teachers. However, anyone can download. It's just whether or not we can provide the incentives for it, the cash incentives, cards rather.
Awesome. Okay. Thank you so much for what you guys are doing. We really appreciate that PAAC is providing these resources to public school teachers. So let me see if we have some more questions in the chat. I do want to ask, I know you guys are doing testing for sports. Can you share a little bit about how that's working or how that enabled kids to start playing sports again? I know Dr. Maunakea, you shared with me about that previously.
Yeah, we actually just started working with the DOE complex school areas in the Waianae district to get people back playing sports. And we actually did our second event on site for rapid antigen testing, followed by PCR confirmatory. And we're still in early stages of development, but that's the plan, is to provide both the education resource as well as the testing resource to normalize the process for our community and just add that extra level of protection that we know works to mitigate the spread of COVID-19. And we hope that that can be in place in other districts where that's going to be a concern as well. Model.
Oh, thank you so much. And then I have a question for Susan, actually, if you are here, about the Board of Education meeting where they announced that they mandated there be distance learning available. Are you here to answer that? Let me give her a minute to unmute here. If not, I can kind of go over it because I am familiar with what happened with that.
I'm here. Can you hear me?
Wonderful. Yes. Can you please turn on your video and we can see you?
Okay, just a second.
If not, that's okay.
Can you repeat the question?
Yeah, so they're asking what their option is for distance learning. So if a child is in a school and their school is not offering distance learning, do you know what's been said about how they can pursue that?
I know that nobody knows right now. I have been watching the DOE website all day, and then somewhere around 4 o'clock, I thought it's not going to happen because they were supposed to post on their website all the options for distance learning and the schools offering it, and if the school had capacity for geographic exceptions. When I called the DOE, Department of Education, they referred me to my complex superintendent. Then I got put over to another person who I just had to leave a message on their phone. So absolutely no information right now that I can give you. I'm hoping that we will have more information by the end of this week. Thank you.
Thank you so much. So I can share what my school shared with me when I contacted them because they are not offering distance learning. They did say that you can homeschool or you can get a GE, which is a geographic exception to a school that is offering distance learning. So that is the option right now, but the Department of Education is supposed to be coming up with a plan in the next week or so. So hopefully we learn a little bit more. But if you are worried about your child going to school this year and you want distance learning, first contact your school. If they do not have a distance learning option, find a school that does, and you can request a geographic exemption. So that is one way we know to do it, other than homeschooling, obviously. We do have a question regarding secondary schools and cohorts. If students are not in the same class and will mingle with others, are they really cohorted, I guess? How do you recommend secondary schools cohort? So any of the doctors who are on, if you want to address that, or if you have any ideas, you can just chime in.
I guess I'll talk about that. This is a challenge. This is where the uniform scheduling challenge is what we need to look at. If you had in a perfect scenario, you would then have a separate cohort in a room where people came and half were from one class and half was from the other class. You would try to then split them in as much of a cohort within the same room versus having them intermingle. That's the best scenario that you can put together in that. And there's all types of other things, you know, when it comes to putting ventilation in different directions, but no, that's the only thing you can do, and that is a challenge. There's no perfect answer.
Awesome. And then regarding ventilation, is there a way that fans should be set up in a classroom?
The key is to have them set to external air sources as possible. So, you know, you want to basically, if possible, have cross ventilation. If you have two sources of ventilation, whether it's a window and a door, have the air moving in a direction, if possible, to create a draft. You don't want the draft to then be pulling across every child, but in a perfect world, you know, the ventilation would come to the center and then go to an external setting. That would be the perfect setting. If you only have a single door, then what you're going to do is have a fan facing to take the air out of that door, and then have other fans that are all directing with as much flow to that exit door to create a more rapidly moving air source if possible. So now I'm going to tell you, I got a little trick, if you know, because we have teachers and educators here, and actually I was called by the NHL and I helped design the NHL, and one of the things I did was design their locker room ventilation in my work. But one of these little tricks that you could do is get some black lights, which are cheap. You can get them at most stores, and then just get a little spray bottle of a very fine mist and put something that's phosphorescent or, you know, illuminates in it. Turn it out, and turn your fans on, and just go around the different areas with some sprays, and just watch which way you're creating some airflow. So, you know, I'm sure we're going to have teachers all over saying, yeah, that'll be preschool. Yeah, but you can, it's really not, it's not perfect, but you don't have to pay a gazillion dollars to study your airflow in a room, but pretty easy, cheap way to do it.
Awesome, thank you. All right, we have a question now for the principal, Paul Kepka, if you're still here and you want to turn on your video and unmute. People are asking what your plans for the fall are going to be, if you know those, your plans for this school year.
Yeah, you know, I think for Kamaile, we're going to try to do what's right by our school community and our children. You know, I think it's important that we listen to our community and the needs, but our plan last week is changing a little bit than it is this week. But right now, the plan is we really want kids back in school face-to-face. I think that with that, we know that as a brick and mortar charter school, that's how, you know, we're designed as a school. So we're preparing for that, generally speaking. We know that there's going to be some exceptions with parents that, as one of the doctors described, may have children that need sort of an exception to that because of some conditions in their family that might not allow them to be in school. But generally speaking, we're aiming to be, face-to-face instruction. But so we're working on plans to bubble kids, cohort as much as possible, students eating outside when possible, limiting the number of children in the cafeteria, keeping kids in sort of bubbles or ohana bubbles, in a sense, by classroom and grade level. We're going to continue to COVID test here at our school for staff and ramp it up to be testing students. I'm really happy to hear what's happening in the department with the athletics program. I think that's really good. I had a parent come to me a few days ago, and they're just so happy that their kids could play sports and that they're able to be tested. So we want to grow that culture, that habit of it's our school, it's our responsibility, it's our community, it's our responsibility. And if everybody does their bit, then we can safely get back into the classrooms the way things used to be if everyone does their part. So that's kind of the plan. I think we're going to continue to collaborate with the Department of Education, with PAAC, Hawaiian Coast Comprehensive Health Center. I think information is key. The faster I think we can get information into the hands of the leaders and the parents so that we can make informed decisions, it'll help us to do what's right by our children.
Awesome. Thank you so much. Awesome. So I think this will have to be our last question of the night because we do need to wrap this up and honor people's time. We did start a little late, so I apologize. We're going a little over our projected time, but we do have a question for a contact tracer. I know we had a couple of contact tracers on the panel and in our audience. If you want to answer this, it says, my school currently only has double desk. This means that K through 5 students will be sharing a desk and will be sitting less than 1 foot from each other. They will also be sitting at these desks for lunch to eat. We have no partitions between students. What are your thoughts? I will have 23 students in my class, 12 desks that will be shared by 2 students each. Many schools only have double desk and not single desk. So they're wanting to know from a contact tracing standpoint, how will that work out? Do we have any contact tracers that want to jump on that question?
Can I jump in, Kara? This is Susan.
Yes.
Inside the post, the chat room, Judy posted the updated link to the distance learning programs. So it must have just came out online. So you all can get to the programs and look and see what all the schools have to offer.
Oh,
thank you.
Awesome. Thank you so much for sharing that. So they just posted distance learning options for you guys to find online. So that's great news. Do we have any contact tracers or medical doctors who want to jump on that?
I can answer it. Actually, my wife is right here, but she doesn't want to come on video, and she's been the COVID nurse for Le Jardin Academy, and they've done a fabulous job. And she looked at me and was like, wow. Her eyes were rolling and saying, really? And she was like, that's really not as much as you can say contact tracing, because they're essentially probably all in the new Delta world. They're all contact tracing out when you put that circle around them. So if you ask me as a physician, as a contact tracer, if you have a positive and then you have a 2-foot desk, of course that person is contacted for being tested on a new cadence, and then you're going to go to the next couple of desks. That's the problem with this Delta variant. If these children are all bubbling around, which we're talking about is important, and they've been in the same room and ventilation is quasi, I want all of them tested. It's almost like that entire room, having been in a period with 40-minute classes and then coming back together. They're not necessarily saying they all have to be purely locked in quarantine, but we would kick the testing cadence up for that group and start them on a broad testing cadence to make sure that that they don't convert. So they're, that's almost going to be a challenge. And this goes back to what I said to everyone. There has to be, and there should be, a very defined policy that doesn't put this in the hands of the teachers And I would be concerned as a health aide. And even in this case, my wife has a whole year experience in this Hopkins strain and all this and this whole process. It's, you could then have parents say, wait, you're gonna send my child home, but they sat over here and they sat over here. No, make it easy on everybody. Have a policy, follow it. And the way you follow it is then you're making sure you're testing these children more aggressively in follow-up, and communicating with the families and parents and the teacher. Let's not stop talking about the teachers. The teachers are all at risk whether they're vaccinated or not, and you have to check them. So I think in general with Delta, unless it's a really separated room with great ventilation, if you're getting positives, you're probably gonna have to go through some cadence for the entire class. I'm not necessarily saying they all are quarantined, but they should be tested at another level.
And what are your thoughts on that setup with 2 kids at one desk? Do you have thoughts on it?
Oh, I mean, it doesn't work. I mean, if you look at even at the, as what we said, the out-of-date CDC 3-foot guidance, it's really not a safe setup. It doesn't work in any scenario for where we are in COVID, let alone now COVID Delta. I mean, this would have been first COVID Wuhan, still a challenge, but no, that's something that I would be very concerned about. And like I said, it could take the whole class out when it comes to anything that could happen. So
awesome.
I do want to have one final question. I was looking to answer a question before. There's a lot of new data that I'm privy to and seeing. New symptomatology for Delta, especially in children. We have, and adults, headache, sore throat, runny nose are predominantly now being the new cluster of symptomatology. Every parent listening, every teacher listening, this is what also makes Delta very, very serious. It's everything. That's allergies, that's drinking your water the wrong way, that's cold, that's so many things that cause that. So we do need to understand that the symptomatology checklist has got to be very broad. And that takes me to another very quick point is we can't leave that in the teacher or the health aide. There has to be very defined symptomatology. And if you have it, you need tested, and you can't come back to school till you get tested. It's not fair to put a decision into a teacher's hands or a health aide or a school nurse or an administrator. Well, you don't look that bad. Because also we have that whole problem that so many children, at least 40% or more, are going to be asymptomatic still. So, define policy that creates safety, that doesn't put the risk into the hands of the teachers, administrators, and other people. That's what I'd recommend.
Oh, and just to be clear, so does COVID affect kids? I know that we're having some people saying, I don't want to get my kid vaccinated because COVID doesn't affect kids, or, less than, 2% of cases were kids at one point. I know that's not true anymore, but.
I'll comment, and if any of the other docs want to come on, yeah, it's the new Delta is significantly affecting children. One piece of data I think I had posted in some of my media was Mississippi came out with a plea to try to dispel this, and everybody knows they're kind of a little bit on, maybe on the red side of the house with their thoughts, but they were pleading with parents to say, listen, it can affect children, because of that 1 weekend, 2 weekends ago, they had 2 children on ventilators, 5 in the pediatric intensive care, just in one city. And we're starting to see that the children and the teens and the 20s and 30s, they can get sick. Again, fortunately, the mortality rate is low, but I came out with a statement in my mind, and hopefully everybody would agree, 1 child on a ventilator here in Hawaii is 1 child too many. That is an awful thing for a parent to have to think that their child could be so desperate that they have to have breathing and are near death. So yes, absolutely, the Delta variant can be affecting children more, and that's why we're talking here. We need to protect our children in the schools.
Awesome. Okay, thank you.
Can I speak up about
yes.
I'm a contact tracer on Oahu. This past week, all of my cases have been breakthrough cases. They are grandparents and they are bringing the COVID to the children in the household. So it goes both ways within the household. We have lots of multi-generational households, and the team that does tracing and tracking for the children in schools is not thorough enough for one case or one household. So we don't have comprehensive contact tracing established here across the islands. Everybody needs to be aware of that. And there are lots of children cases right now that are not being reported.
Wow. So for the contact tracing, when the kids go back to school, does the school do the contact tracing, or is the Department of Health doing the contact tracing still?
For public schools, I think it's largely handed to the Department of Health. Some schools, including private schools, are doing their own tracing, and they don't work with the Department of Health in that most of the time.
Okay, awesome.
Kara,
yes,
I can add to that too, if it's helpful. I think there might not be a unified approach to that. And on different islands, for example, on Maui, I think what I have heard from Department of Health is that schools will be responsible for their own contact tracing. And I can share that as someone with a background in case investigation and contact tracing, that it's a very big job and a lot to expect of teachers and staff people and non-medical people. And so I'm very sensitive to hearing, about the situation. And we're here on highcovid.org to, assist anybody with questions regarding that too. Mahalo.
awesome. Thank you. I just want to wrap this up to honor everyone's time, but if anybody does have any closing remarks, you can add them. Just let me know in the chat and I can add you to this. But I want to first say mahalo to all of our panelists who answered and participated. Also, all of our participants, which we have so many. We also have some great supporting organizations. My organization that I founded is Hale Hawaii. We're a community advocacy group, and we fully support PAAC and their efforts. We think it's wonderful. We love our public school teachers, and when we learned about this, we wanted to share it with you. This town hall today is brought to you by highcovid.org. I am one of the volunteers with that group, but Dana is our great leader. She leads our meetings every week, bringing together healthcare providers and recently educators. So if you want to talk directly to doctors during a Zoom meeting in a more casual setting, I encourage you to check out highcovid.org. We also have some announcements. There will be a Board of Education meeting coming up, and we encourage you to tune into that. They're going to post the information about it on the 23rd. There's also going to be a Civil Beat Town Hall happening tomorrow. It's called Civil Cafe. It's going to be from 2 to 3 p.m. and it's called Back to the Classroom, Looking Ahead to the New School Year. PAAC has a survey. Dr. Maunakea, do you want to share about that survey?
Sure, please, we encourage anyone here participating to join us in our PAAC survey. There's information online at paac.info. Mahalo.
Awesome. And then we are planning to do a follow-up town hall after school starts on August 7th to kind of talk about how it's going and what we can do to improve. We are still setting up that agenda, so not 100% sure what we're going to be talking about that day, but it will be all about school still. August is Teachers Month. highcovid.org is inviting all teachers to participate for every Wednesday in August. The meeting's at 6:30 p.m. and you can find the meeting link at highcovid.org to talk specifically about school safety. And Dana, do you want to share with the statewide catchphrase challenge that?
Hi, I don't know if my video's on, but I'm Dana. My name's Dana Moore. I'm a nurse. I have a background in testing, tracing, vaccination, and community education. And like Kara said, I've been involved with Hawaii COVID-19 Healthcare Provider Task Force since the beginning of the pandemic. And we've got a really unique collaboration happening between healthcare providers and scientists. And we've brought in discussions with community leaders and organizations throughout the pandemic. And this task force has been really pivotal in, bringing the science-based recommendations. And we're there on Zoom so that we can hear the community's concerns. It's an open forum format, and one of the efforts that we have is Protect Keiki at School. So the statewide catchphrase challenge is going to be something that we want to really give to the community. Personally, I've been coming up with catchphrases all year long, and you probably see me blasting those out in comments. But, we would really love the community's help in figuring out how to name this, challenge or come up with a slogan that really defines how can we keep Keiki safe, and bring awareness to that. So I'm going to put that challenge out to the community, and between now and August 7th, could you please visit our Hawaii COVID-19 or highcovid.org Facebook page, and please, like and follow that page, and then we'll have a way to put your entries in. We also have a website, highcovid.org. So please, if you want to keep updated, there's a great way to get updated on these future efforts. Right on that page, there's a link that you can put your information in. We really need teachers and principals to please get involved in in these efforts, and just sharing information is enough. So we really do provide a safe environment for everyone to come in and share.
Awesome. Thank you so much. We appreciate everything that you do and all the work you put in. I want to thank all of our panelists once again who came on tonight, and we look forward to future town halls. Hopefully we get our town hall going live on Facebook on time next time, but thank you so much to PAAC. I really appreciate what you guys are doing, and we strongly support your efforts. We'd like to see this happen on every island, the initiatives you guys are putting out to make schools safer. Mahalo.
Mahalo.